We'll move on to the signs and symptoms of systemic sclerosis. So the first sign of systemic sclerosis is actually the development of puffy, thickened and hard skin in the fingers and toes. So if you look at the first picture here, you may be able to appreciate the puffiness, and the skin, if you actually feel it, is actually quite thickened and hard in this patient's fingers. And gradually, the hardening of the skin can actually lead to skin tightening. And if you see in this picture here of a hands of another patient, there is actually contractions going on, and this patient actually have decreased joint mobility that resulted from the hardened and tightened skin. And patients may also complain of intense skin itch and inflammation of their skin. Reynolds phenomenon, we briefly talked about it earlier, which affects about 90% of our patients with systemic sclerosis, often precedes skin changes. This may be of a longer duration in the limited subgroup, as we have seen earlier, and in the diffuse subset, this may occur within 1 year. So as I've mentioned, Reynolds refers to a patient's fingers or toes turning white, blue or red in response to cold temperature, and patients along with a color change may also complain of some tingling, discomfort or pain in their fingers and toes. Some of our patients may actually go on to develop digital ulcers, and these are painful sores on one's fingers and toes. So we have seen this patient's hands with Reynolds, and then here is patient's hands, which actually illustrates, I think you can see this are areas of scars or ulcers that are actually healing. You can see the fingers are also slightly bent as well. Actually, there's an ulcer here if you look closely. When the joints and muscles are affected in systemic sclerosis, our patients may complain of pain, swelling, and stiffness, and this may also lead to them feeling weak when their muscles are affected, and they may have problems going about their daily activities, such as the exercise that they are normally able to do. When a patient experiences digestive system involvement, these are the myriad of symptoms that they can experience. In fact, digestive system involvement occurs in about 90% of our patients with systemic sclerosis, and this could be one of the earliest manifestations when the patient has this condition. So as I said, the symptoms that they experience may range from that of swallowing difficulties. They feel that it's easier for them to swallow liquid foods, foods such as porridge, compared to dry foods such as biscuits or rice. They may also complain of heartburn or reflux symptoms. They feel that they get bloated or abdominal distension very easily, even after small meals. Some of them may experience vomiting. Some of them may complain of diarrhea or constipation. And when there is anal rectal involvement, some patients may complain of fecal soilage. Because of the poor oral intake, the poor nutrition, some of our patients may also experience significant weight loss during this time. When the lungs are involved, patients may experience persistent coughing that do not go away, and breathlessness as well. And they may also notice that their effort tolerance may have decreased. In the past, they may be able to walk for a longer distance. Right now, they get breathless easily after walking for a shorter duration or a shorter distance. When there is heart involvement, they may also experience chest pain, and some of them may feel that their heart is beating faster, and they feel that their heartbeat may be irregular as well. When there is kidney involvement, patients may notice that their blood pressure are on the higher side, and along with that, they may complain feeling more tired, more fatigued, and lethargic as well. When the tear gland and the salivary glands are affected, Patients may also notice that their eyes and mouth tend to get dry quite easily. Despite drinking sufficient water, they feel that their mouth gets dry easily, and they have this gritty or dryness sensation in their eyes. And this dry mouth may lead to tooth decay, and in this group of patients, dental health may also be compromised. Because of the tight facial skin, they may also have difficulty in opening their mouth, and therefore their oral hygiene may also suffer. So in my previous few slides, I've actually gone through the signs and symptoms that patients with systemic sclerosis typically experience, and I've put this figure up here to summarize the signs and symptoms that I've mentioned earlier on. So starting from the hands and the feet, our extremities, Reynolds are a very common symptom that patients experience. This is due to narrowing of the blood vessels in our extremities because of the collagen deposits, and patients experience or notice their fingers turn pale or blue, in the aircon environment, like when they go to supermarket, when they are at the freezer section, they notice that, how come my fingers are actually turning pale or whitish or blue? They may experience pain in some instances, and some of them may develop ulcers or sores on their fingers and feet. With joint and muscle involvement, they may complain of pain, stiffness, which may gradually progress to weakness. Digestive system, as I've mentioned earlier, it's also a common presenting manifestation, and problems that they experience may be to do with swallowing, reflux, nausea, vomiting, bowel problems, and weight loss. Heart and lung involvement, they may get breathlessness, chest pain, as well as persistent coughing. When the kidneys are involved, I mentioned earlier on, the blood pressure reading may go up, and this is actually an emergency that requires urgent assessment.